brief introduction before I get started with the Acupressure. So my name is Dr. Amanda Occhipinti, and I am a doctor of acupuncture. I practice in Berkeley Heights, New Jersey. I've been a part of Team NutraBio since 2014. My practice constitutes of anyone between, children, adults, the geriatric population, teenagers. I've treated professional athletes from the NFL and the NHL. I treat a lot of musculoskeletal conditions, internal medicine conditions. I'm certified in facial rejuvenation acupuncture, and I specialize in hair loss. Hi everybody. So today I would like to share with you one of my favorite stress release protocols, acupressure protocols. And before we get into that about the acupressure, I also just want to describe a little bit of acupuncture and talk about the difference. And then before we get started, also, this protocol is not intended to diagnose or treat any disease. It's for informational purposes only. So acupuncture. Acupuncture is a technique where small, thin, usually and always sterile, solid filiform needles are inserted into the body, and they are typically inserted into very specific points that are on the body. He's called the Soon Man. So these are some of the acupuncture points that are on your body. There are actually more acupuncture points on the head combined than the entire body. And one of the protocols I would like to share with you is located what's on the ear. So in that area, it's been around for about 2,500 years. That's a really long time, and I don't think it's going anywhere. So it is an ancient medicine and an ancient art. And the healing system in which we provide the acupuncture is through the meridians. So these acupuncture points are along acupuncture meridians. And what I find actually quite interesting is the meridian system was developed 2,500 years ago without actually anybody ever performing surgery. So they were able to come up with this network of healing without knowing where the internal organs are, but yet there are meridians that are sort of associated with the liver and the kidneys and the heart and the lungs. So that's pretty fascinating that they were able to feel the energy that we all have in our body and then actually come up with this network. And then if you look at some of the images of nerve pathways today that actually resemble, you can see that there's a meridian that goes right, by the sciatic or through the sciatic nerve pathway, one that follows the fascial plane that starts at the bottom of the foot, goes around the back of the body, and then terminates at the forehead. So there is merit to the foundation of acupuncture and the meridian system. So the meridian system is how we heal the body in acupuncture. Little explanation about how I like to tell people acupuncture works. So when I look at my Soon Man, there's a little bit of a glare. It kind of looks like a circuit breaker. And what happens in the body is when you have physical, mental, emotional, hi Laura, physical, mental, emotional, environmental stress happen, or even a trauma, circuits get tripped. But the body does a really great job of adapting. So what happens is these pathogenic rewiring occurs. And that's why people can get pain in their shoulder and it just won't go away, or these headaches that just won't go away, or that eye twitch that just won't go away. It's because these circuits get tripped. Now, if too many circuits get tripped, the lights go out. But if not, then that rewiring happens. And acupuncture is actually all about finding where those circuits are tripped and then turning the lights back on. And it's your body's own natural healing ability that does that. So it has a very gentle adaptogenic effect. There are certain techniques that we can do to help stimulate or suppress certain things, but overall, your body really takes what it needs to restore homeostasis. So it's a little bit about acupuncture. And acupuncture, depending on what state you're in, is administered by a licensed healthcare professional. There are some states who you have to be an acupuncturist, or other states where you can be a physical therapist or a chiropractor. And we can talk about dry needling at the end if anybody has any questions about that. I'd love to explain what dry needling is. But acupressure is utilizing, hi Alex, the acupuncture system, but instead of using needles, we're going to be using our hands. So we're going to be lightly, very gently stimulating these points. And hi, Alyssa. Before we get started with any touching of anything, I'm going to wash my hands because we'll be touching my ear and we'll be touching other places in the body. So I want to make sure we follow clean technique. All right, into the acupressure. So there is a very common acupuncture, and for us it'll be acupressure protocol called Buddha's triangle. And the triangles, look, it's 3 points that make a triangle, and it's all about promoting calming the spirit, calming the mind. So there are other triangles in the body that perform the same reaction. And so what I actually did was, one day I thought, well, what if we made a triangle with the triangle points? So it's a triangle within a triangle. And then I started thinking, as I do sometimes, I get very excited about these ideas, is when you look at the shape of a triangle, there are 2 points at the bottom and 1 at the top, meaning triangles are really grounding. So it really helps to ground your spirit, helps to reduce stress, calm your mind. And the beauty about acupressure is a lot of times stress is induced from our thoughts. Yes, we can induce stressful situations with, exercise, but I'm not talking about that. But when we say, I feel anxious, you have that's feelings are physical. Thoughts are emotional. So are you what does it feel to feel anxious? It's often very thought driven. And when we do acupuncture and acupressure, we have to touch, we have to feel. So it really integrates the mind and the body again, whereas a lot of times, our minds can be, if you think of things like a stoplight, our minds are in a red, but maybe our body's a green. But our minds have us so convinced that everything is red, but our body's are green. So the acupressure kind of helps to, like I said, integrate the mind and the body. And if the body is green, bring the mind down to green. Or maybe it's the reverse. But let's get started with the first triangle. So the first point is located, I'm just going to move him out of the way, 2 inches below the wrist, in between these 2 tendons. So a really easy way to find that point is to take 3 fingers, put it at the wrist crease, and then where my ring finger, the ridge of my ring finger terminates, that's where the point is. So I just slide it this way and then I press there. So that's the first point. It's called pericardium 6 in acupuncture, or that translates to inner pass. And this point is really helpful to, if you're feeling any internal chaos, calm that down. A lot of times I know I find myself saying, I have a gut feeling. I feel it in my gut. This point helps to balance the connection between when we just have an intuition or we feel something in our gut, because it does relate to the epigastrium, which is where the stomach is located. It's also along the heart protector meridian, so if you're feeling a little vulnerable, this is a really good point to use as well. The next point in the triangle is located on the radial side of the artery, so you'll feel a nice little pulse there. And this point is lung 9, and that translates to supreme abyss. And the lungs in Chinese, more acupuncture medicine, relate to sadness and grief. So if you're struggling with any feelings of sadness or having a hard time letting go of something, you want to hit this point. And then the third in the triangle, I'm going to have to fix my location. You can see I was practicing pushing on the points earlier. This point is Heart 7, which also stands for Shen Men or Spirit Gate. The heart in acupuncture medicine is the center of all the emotions, and that's where our spirit thrives from. So important to hit this point. It's located on the radial side of the tendon flexor carpi ulnaris. So the way that you want to stimulate, do some acupressure is 1, 2, and then I take it with my thumb, 3. Now I'm using the left side for this exercise, but you could really do your left or your right side. The biggest thing with doing the triangle with the triangle is you want to do 2 on one side and 1 on the other, so you're making the triangle. How long do you stimulate these points for? At least 60 seconds. You can do it for as long as you need to, so if you're feeling particularly anxious or if you're feeling just a little off, you can do it until you stop feeling that way. But at least 60 seconds. Usually you'll start to feel some sort of shift either in the points themselves or in your body. That's kind of how you know that the points have been activated. Okay, and then we'll move down to the next triangle. It's by the ankle. And then I'm happy to answer any questions if we need to go over any of these points, because it is a lot of information at the end. Okay. So the first point is liver 4. It stands for middle seal, and it's located in this depression between the tendon by the tibia and the medial malleolus or the ankle bone. So hold that there. The liver, do you focus on? Absolutely, and I'm happy to share some of my most favorite breathing techniques, especially when we're up at the air at the end. So yes, breathing is so important. Okay, so back to liver 4, middle seal. So I mentioned that in acupuncture medicine, the lungs relate to sadness and grief. The liver relates to anger and stress. And so if you're feeling really, really wound up and really, really tight, or you're just sighing all the time because you're so irritated, hitting this point will help to release some of those emotions. The next point, now, if you're pregnant, please do not apply any acupressure to this point because it stimulates energy in the uterus and uterine contractions. So we don't want to do that unless you're in a very specific part of your pregnancy. And so if you're pregnant, please avoid doing acupressure here. But this point is located 3 inches up. You'll find a little depression from the ankle bone. So we'll go 1, 2, and this point is spleen 6, and it's the 3 yin intersections. So the 3 meridians or healing pathways of the lower body intersect here. The spleen is associated with worry and feelings and thoughts of overthinking. So that's why we include this one here. The final point at the ankle is located in the depression between the ankle bone, the ankle bone and the Achilles tendon. So the depression right here, and you can see, kind of, there's a triangle. This point is along the kidney meridian, and kidneys are all about anxiety and fear, but it's more, so worry is also feelings of anxiety, but with the kidney, it's more of that fright, fear, as opposed to the worry, fear with the spleen. So that's why we include the kidneys as well. And then finally, so there's a whole other system of acupuncture, acupressure, where it's like reflexology, where we can use the ear to treat the entire body. So the entire body is reflected on the ear. So if you wanted to receive a full body treatment, you could just actually use the ear, which is pretty fascinating. And the way that the anatomy is structured on the ear is it's actually, Craig, it's a reverse fetus. So a lot of the, you'll see jaw and mouth, these are here, and then like ankle, knee, those are up in there. So the first point out of the 3 for the triangle in the ear is Shen Men, and it's located at the apex of, this is the triangular fossa. Shenmen is probably one of the most studied acupuncture points or acupressure points for, hi Diane, for reducing anxiety, balancing the autonomic nervous system. And so you want to make sure you include that one. And then the next one is located on the inner border of the helix of the ear, right where is the anterior helix crux. So it's right there. I'll show you on my ear, it might be a little easier. This point is actually called sympathetic, and it's called that because as it's been studied in research, it actually helps to balance the sympathetic nervous system with the parasympathetic, reduce sympathetic tone. If there's any visceral organ dysfunction, it helps to treat that. So based on the name, you can understand a lot of its function. And same with this one. The next one is point 0. So it's located right in the center of the helix. And this point, actually along with pericardium 6, the one in between the two tendons of the wrist, have been studied to improve heart rate variability scores in patients who have this point needled before and after. So on my ear, what I'll do is, and you have to just forgive my dogs they're jealous they're not in here, if you can hear them. So Shenmen would be about right here. Sympathetic would be behind the helix on the anterior helix crux. And then point 0 is right in the center of the helix. So, and I would probably be doing this, so actually for accuracy, I'll do it on this side. So 1, 2, 3, because I did the wrist, my left wrist, so I want to do right ear and right ankle for about a minute, or as long as you feel is good. So that's the triangle with the triangles within the triangle. Really good for calming the mind, stress relief, lifting your spirit, which not only we need right now, but all the time. So that's it. One of the breathing techniques that I'm a huge fan of is the Wim Hof breathing technique and his cold shower therapies. What I'll do is I'll take a cold shower and I'll do some of the breathing. So if anybody, you can do a little Google search and look into Wim Hof, W-I-M-H-O-F. But if you don't want to go down that route, a really simple breathing technique that I like to do, I like this cadence, but some people might want to change it up, is you breathe in for 4, you hold for 7, and then you breathe out for 8. So 4, 7, 8. You can do a little Google search about that too, and there's some research to back how that specific sequence can also help to activate the parasympathetic and deactivate sympathetic. I call it being activated when I'm just activated. Some other techniques in it while I do acupressure on myself. Breathing, acupressure, and then actually finding mid-frequency music has been shown to take us out of that red light, that freeze, because we have fight, flight, and freeze state, and bring us back down into the green. So like Disney music, Bob Marley for me, UB40 really brings me back down into the green. So finding some music that you can put on also while you do these techniques can be helpful. And if anybody has any questions, I am happy to stay on for a little bit longer and answer them to the best of my ability. Hope you're all ready to try some acupuncture, give yourself a little bit of stress relief with the acupressure we showed you today. And I want to say thank you to everybody who has tuned in and taken the time out of their day to watch the video, and anybody now live or in the future. So thank you so much for sharing your time with me. I do appreciate you, and I appreciate that. You are most welcome, Amanda. Can you touch on some of the breathing techniques? So one of the breathing techniques two breathing techniques that I really like are the Wim Hof method breathing. It's great for your immune system, great to help I appreciate you too, Dawn. Thank you. And you're welcome, Andrew. I'm glad that you enjoyed it. Good, thanks, Alice. So Wim Hof's been shown to help improve the immune system, but what of the other benefits of doing that method is you kind of you start to hyperventilate, and if you can introduce self-induce a stressful situation that you know you have complete control over, any other stressful situations that you're faced with that day or going forward in the future your body's able to adapt better to them, because you recognize that you actually have complete control over your body. So that's one of the ways that technique is helpful. It's 30 breaths. You take a full breath in, you don't breathe all the way out, and then you repeat that for 30 times. And then if you don't want to go down that route with the Wim Hof breathing, very simple 4-7-8 breathing. So you inhale for 4 seconds, hold for 7, and then breathe out for 8. And then you just repeat that at least 4 times. It's actually kind of difficult to do, especially in the beginning. So you start with 4, and then you can work your way up to as many as you feel like you need to again bring you out of that red and into the green, and help reduce any stressful feelings that you're having. We don't want to neglect our feelings. We want to feel our feelings, but we also want to learn how to cope with them in a healthy way. But was that sufficient, or would you like more information on some breathing techniques?